The analogy I use is like the thought process and decision making. A T cell will be sitting there and it'll bump into a viral infected cell or a cancer cell. It has to respond to what it's seeing. Is it going to keep moving, or is it going to actually attack this cancer cell? And so they're little decision makers, right? They sense something and then they have to internalize that signal and then, make a decision. And in that case, it's, turning on a cytolytic program to kill that cancer cell. But, I use these terms like thought process and decision making anthropomorphically, but like they're not people, right? They're just bags of biochemistry, responding to their environment. But there's so many things that they can do, and there's so many things that they can sense, and it's never just one signal. It's usually like a little bit of A, a little bit of B, a lot of bit of C, and those change over time. So they have to internalize all that. And they do that through these biochemical networks, and that's what my lab studies. So I use the biochemical networks as like the thought process, right? Like how is it thinking about what it's seeing over the here and over there, and then what's the decision it's gonna make by the response it's eventually gonna turn on.
I was terribly distressed to watch as my beautiful, bright daughter suffered terribly, being dismissed, disregarded, and not really believed by so many. I have since discovered that this is a nearly universally shared experience of people with autoimmune disease. What happens? What makes the difference? We need to know, and he's going to help us answer this very crucial question.
Immunologists and researchers have come a long way in analyzing what happens when immune cells go wrong and cause autoimmune disease. And I think that is a wonderful progress. But I think the real gap is in translating that into therapies. But I have no doubt that that gap is bridgeable.
Autoimmune diseases are systemic. They need to be considered as a whole, just as cancer is, as a family of diseases.
My name is Sam Myers. I was granted the Global Autoimmune Institute assistant professorship, and I think it's one of the first ones that they've given out. GAI is just not making an impact, right? They're setting a standard. With foundation funding, it moves faster. They asked me, why are these important other than the funding? Investments like this show that people believe in me, right? So I sit in my office by myself all day, just thinking about the same things over and over again. And that gives you a lot of time to kind of sow doubt. Like, am I overthinking it? Am I underthinking it? Am I missing something? But then you come along and support me with something like this. And it really shows that I might be on the right track. And other people think I'm on the right track. And I think that's a really important thing that I didn't even realize until kind of this whole gathering began. So very much I appreciate you, and I appreciate everybody's done to support it. It's a passion of mine. It's not a job for me. It's not a thing that I turn off when I go home. It is something I think about all the time, and I'm curious about things all the time, which is a blessing and a curse, but I'm very happy with it. I'm very content, especially at this level now, because I get to share that with other people and make them enthusiastic and get them passionate. I'm poised to make differences in people's lives, and I think that's really what I want to do in the end. That's the end game, right? Is to alleviate some suffering of people with autoimmune diseases.